Okay, all right. So we start recording. We started the recording. So as I mentioned earlier, we have 4 topics: children development, adolescent development. We've covered that earlier on. So we'll carry on with the other 2, the parenting style and attachment. Now, parenting as attachment is essentially the social component of it. Tadi we mentioned earlier about biopsychosocial. It's a social component, tapi it's closely associated with psychological. It basically explains how our interaction with life in earlier part of our life dengan parents, dengan peers, dengan people around us will influence our psychological development. So that's why we put this topic together with the psychological development of child and adolescent. All right, so let's move on to the uh, okay, so let's move on to the slide. Can you see the slide now? Parenting styles. Boleh ya?
Yes, Doctor.
Okay, all right. So parenting style is easy. All you need to know is there are 4 types of parenting. There are different theories of parenting, but for the purpose of this topic, we'll highlight only 1 type of parenting styles for you to know. So parenting styles is basically defined along 2 dimensions: interaction of parents to the child with regards to these 2 dimensions. Number 1 is responsiveness. Responsiveness is basically how you attune to the child, how you respond to the child's needs and interests. That means your ability to react with the child's needs and interests. So that's 1 domain. And second is control, which basically how much supervision and discipline and control you impose on the child when they grow up or when they are around you. So the degree of responsiveness and control varies differently. So some parents are very responsive, some parents are not responded at all. Some parents are very controlling, some parents are not so much in control of their children. So therefore, the different styles, so people study about these different styles and eventually comes to the conclusion that there are 4 types of parenting styles that you can derive from these 2 domains. Okay, the first one is authoritative, second one is authoritarian, third one is permissive, fourth one is neglectful. Now, let me show you this slide, this picture, so that you will be able to appreciate more what I mentioned. All right, now, so if you look at responsiveness level, okay, so there are parents who are very responsive to their children, and at the same time do not impose any control at all. So basically they have high response but low control. Child menangis, dia terus datang, oh kenapa, very responsive. And then when child, for example, make trouble because they want gadget, they will give it. So that means high responsive, low in control. So if you look at the table, 4x4 table, so that particular types of parenting fall under permissive style. So low control, high responsive, permissive. So basically, parents are very indulgent, very responsive, but low in control. But there are also parents who are not responsive at all to the children. I mean, you want to cry, it's up to you. You feel sad that you didn't get something, I don't care. But at the same time, when it comes to discipline, they are very controlling. You cannot have this, you cannot go there, you cannot do that. So basically means they have low responsiveness but a very high control. So this one is what? Which one?
Authoritarian.
Authoritarian. Okay. So you dah faham dah cara nak tengok this table. And some not really responsive and not really controlling. So that is neglecting parenting. So the ideal way of parenting is basically authoritative. That means you are authoritative, sorry. You are very responsive, and at the same time you have some degree of control. You have balance between responsiveness and control. So that is authoritative parenting. So in short, basically parents who are authoritative and they tend to have this approach. Let's talk about it. That means I'm aware of your problem. So that means high responsiveness. Let's talk about it. Let's discuss about what we can do about it. A balanced degree of control. So that is authoritative. So senang nak ingat, authoritative, dia positive. So it's a good one. Some parents, you have to stop. You cannot go because I said so. That means they respond, but they very controlling. Sorry, they're not responding and they're very controlling. So that is authoritarian. So authoritarian ni dia almost macam macam apa? Macam veto. Dictator, true. So very dictatorship kind of parenting style. Permissive is you are in charge. What you want, whatever you want, I'll do it for you. I'll give it for you. And so agak-agak parents macam mana yang tend to be permissive?
Bapak.
Kan, parents macam mana? Parents macam mana yang tends to be permissive? What kind of parents?
Yang kaya.
Busy parents.
Workaholic.
Okay. So maybe ini stereotypical lah, tapi maybe parents yang kaya kan, parents yang ada apa high economic status, yang rich, yang apa namanya, yang ada certain status lah. Okay, alright. Now another types is the low in expectation, low in response, low in control, which is neglectful. So parents macam mana yang neglectful?
Parents yang tak selesai masalah sendiri.
Divorce family.
Parents yang abusive, parents yang ada own psychological problem, parents yang ada drug use for example. So there are parents yang macam ni. Now, parenting styles ni is not really rigid. So basically means it can change over time. So contohnya ada certain parents, masa dia ada anak sulung, masa dia muda-muda, when they're still young, they are very authoritarian like. Tapi bila anak kecil-kecil, dia dah elderly, anak yang bongsu, anak yang last, the younger children, they tend to be
permissive.
They tend to be permissive kan. So sometimes that can also happen. Or it can also be parents yang ada a mixture of different parenting styles. And contohnya bila dia cool sikit, dia authoritative. Bila dia stress, dia become authoritarian. Bila dia maybe banyak duit sikit, dia become permissive. Or bila dia stress, dia ada problem, dia become negative. That can also be possible. But generally speaking, parenting styles ni there will be a dominant one lah. Maksudnya there will be no perfect parents. Maksudnya there will be no parents yang ada only one style. But generally speaking, there will be one predominant style. Okay, for example, kalau in psychiatry, whenever you have a patient, one of the things yang kita ask in the personal history is, how do you find your parents when you were growing up, for example? So normally, our memories will highlight things that are predominant. Okay, so if I ask you the same question, so all of you will have some ideas which kind of parents that you had in general. It's not just about who they are, who they were, who have that thing, but it's also about thinking pasal who you want to be once you become a parent. So that's important about parenting styles. Okay, now, so that's all that you need to know. You need to know the names of it, the different types of it, and a description of it. Okay, the description of it too. Basically, once you understand the concept of it, you'll be able to elaborate, because examples are various. It can happen in many forms. Okay, for example, authoritarian parents. The examples highly punitive. They dislike if children questions their rules. They control every single thing. They control who their children want to play with. So those are examples of authoritarian. Right. Another things that you also have to remember are the outcomes. Okay. So what would likely to happen if somebody have authoritarian parents when they grow up? Okay. So it's basically logical. If you think about it, it's not really something that you have to crack your head to understand. If you think about somebody young, parents disallow them to do anything, very strict rule, cannot go out, cannot do that, cannot try that, cannot buy that, cannot do that. So what do you think that the children would turn out to be? So examples given here, obedient. So that's also possible. And contoh anak-anak askar, contoh kan, jadi typical kan, stereotyping, stereotyping pula saya. But example is dia jadi disciplined. Okay, so that's one of the outcome. The outcome can be good, can be bad. Okay, distrustful, discontent, because they never trust their parents, they dislike their parents, so that can happen as well with others. Withdrawn, unhappy, hostile, and not high achiever. That's also a possibility. But there are also people who have authoritarian parents, but better in academic, and one of the reason is because the parents control their time, their study, their schedule and stuff. Right. Permissive. Okay, so permissive examples make little respect for order, routine, or you want to eat a cereal in the middle of the night, that's okay. You want to drink coffee, you want to drink chocolate, milk in the middle of the night, that's okay. So they have little respect for order and routine. Make few demands, so you don't have to worry about shoes, I'll wash it for you, or baby wash it for you. You don't have to worry about your timetable, I'll arrange it for you. So these are an examples of permissive parents. What do you think outcome of permissive parents? Apa possible outcomes of children with permissive parents?
Spoiled child.
Spoil, okay. Lagi?
Lack discipline.
Lack of discipline. Okay, true. Okay, so some of them can become aggressive because no one's control them. And then when they go to university, for example, they go to boarding school, for example, and suddenly there's a rule. So as a result of that, they become disobedient. They become aggressive. They are not trained to follow rules. Okay. Least self-reliant. Least self-reliant basically they're not able to do things on their own because parents do things for them. Least self-control. They cannot make decisions. Least exploratory. They're not up to. I cannot go. I cannot go buy things on my own because normally parents will decide for me. So these are examples, and they can be unhappy as well, even though some can be happier. Authoritative. These are basically a good balance between responsive and control. A middle ground, they say. So itulah. Okay. So outcome, happy, cooperative, high achiever. So this is semua yang good lah. Alright, now let's have a look at this timetable. Jangan tengok dekat you punya notes and just make a guess based on what we've discussed about the outcome. Okay, so the left side too is the parenting style, and the right side too is the domain, self-esteem. Okay, now what do you think the self-esteem of children who develop in authoritarian parenting style? Self-esteem dia positive or negative?
Negative. Negative.
Okay. Permissive?
Over positive.
Over positive.
Positive. Permissive basically means parents allow them to do everything. Parents do things for them maybe. So self-esteem can be negative in those with permissive parenting because they feel like, oh, I cannot do things on my own because all this while parents are doing it for me. Okay, so sometimes they can have negative outcome in terms of self-esteem. Neglecting?
Betul.
Negative.
Ada soalan?
Untuk permisif, kalau parent jenis supportive tu permisif ke tak?
Parents jenis?
Supportive buat dah apa nak buat. Kalau Tak pernah. Supportive.
Supportive tu is basically yang general, supportive tu in general, but what do they support? Kalau yang authoritative, dia akan support yang good one, akan restrict yang bad one. Tapi in permissive, dia akan support whatever, even though it's negative one. Contoh, I want to color my hair blue. So authoritative will say no, I'm not going to support that because that is inappropriate. But permissive parent will support. That's okay. Whatever color you want, green, yellow, gold, doesn't matter. And so depends on what kind of support lah.
So Doktor, supportive bukan menyebabkan jadi have esteem tinggi ke Doktor? Self-esteem tinggi.
That's what I said. It can be both positive and negative. Depends on what kind of support that they give. Okay, authoritative, positive lah. Okay, kalau we look at something else. Emotional health. Okay, emotional health. Kalau neglecting parenting, you rasa emotional health tu positif ke negatif?
Negative.
Negative.
Negatif. Okay. Behavior yang authoritarian, positif ke negatif?
Positive.
So they can have positive behavior because of the control that the parent have, kan? Kalau neglecting,
Negative.
negative lah, because there's no rule, kan? No one's there to control their behavior. Alright, social skills. Kalau neglecting, positif ke negatif?
Negative.
Negative. Okay. Kalau authoritarian, social skill, positif ke negatif?
Negative.
Negative. Okay. Alright. So you have some ideas lah about what could it be. So this is based on this study. Okay. So based on this study, according to them, the worst one is neglecting parenting style, which basically have negative effects on all domains: self-esteem, emotional health, group behavior, grades, social skills. But in the positive one is authoritative. It's basically you have good in terms of your emotional well-being, your character, your competence, your ability to relate with others. Okay, but of course this is not rigid, and this really depends on other factors as well. But these are some of the examples. All right, now that's all under parenting style. So if I ask you to recall parenting style, all you need to know is number one is different definition of parenting style, which is the 2 dimension that you need to remember. Types of parenting style, that 4 types of parenting style, and at least some ideas about features of it and outcome of it. So when it comes to outcome, if you can remember these domains, it's pun dah good enough. So with regards to self-esteem, emotional health, behavior, academic performance, social skills. Okay, so for example, if you have essay questions on write an essay on different outcomes of different parenting styles. So you have to tell everything. So you have to give introduction, and maybe you can write down definition of parenting style, and then you can begin with different types of parenting style and what defines each type of parenting style, what are their characteristics, and then the outcome you can give examples of these domains lah. Okay, so once you have some idea, and maybe you can give examples in order to get in order to make the answer is richer or deeper, you can give example. For example, and why patient with authoritarian parenting style has low self-esteem. Let me give example. So one of the common manifestation is the parents always questions children's decisions, always argue children's punya actions. Therefore, patients have difficulty in developing their own self-confidence. Therefore, it affecting their self-esteem. So that's probably an example that you can include in the essay lah. Okay, all right. So last one is attachment. So attachment ni is an extension of that. It's also not that difficult, but let me just can you see my slide now?
Yes.
Okay. Right. So attachment is about it is an extension of the parenting styles, but it is not specifically limited to parents and child relationships sahaja. Okay, so let's have a look. So attachment is basically emotional connection that you have with special people in your life. Okay, so for a child, for example, if a child is attached to the mother, basically, child is emotionally connected to the mother. If you come to if you come to any person's house, you greet or meet the child for maybe 1 hour or so, and then you go home. So the child is not emotionally connected in any way to you. So that means you do not have any attachment to the child, and the child do not have any attachment to you. So because attachment is not defined by connection or relationship or formal relationship, it is defined by emotional value. So that is what attachment is all about. So it's a result from infant's innate tendency to signal the caregiver and the caregiver's corresponding predisposition to react to these signals. So basically what it means is the child has a tendency to, the child needs warmth, comfort, and food, for example. So this is the signals that they want. So another person mother is another person who can respond to the signal. So the mother can give warmth, comfort, comfort as well as milk to the baby. So whenever these two interaction occur, so the emotional connection develops. So the attachment, a proper attachment later develops. So why do we bother about attachment? Is because attachment is an important part of a person's ability to develop relationship in later life. Okay, so I recently tweet something along this line. I said many patients who tend to have, for example, a self-harm behavior, and then tend to do things in order to get attention from other people, is essentially sebenarnya is somebody who is craving for attachment, because commonly those who have emotional problem normally have attachment problem in early life. So for example, classic example, somebody who has abusive parents have attachment problem. When they grow up, they have problem in relationship. So they have problem in trusting their partner, or they have problem in a relationship in which they're always in the state where they are afraid that they will be left. So fear of abandonment is also another common problem in people with psychological problem. So essentially what they lack is attachment. So that's why attachment is important. All right. So in the first month of life, the child become attuned to social and interpersonal relationship, their response to their external environment, and started to form relationship with primary caretaker. That means they start to know, or they start to react to those who can provide their distress signals. So mostly mother, okay. So ethologists ni those who study animal behavior start to understand about attachment based on their observation to animals interaction. So for example, birds, if you have birds, you take the baby bird and put it to any other bird. Once the bird, once any other bird can provide the food or the warmth, they akan attach to that bird. So basically, authorities start to developed this theory that it's that component yang menyebabkan attachment to occur. It's not so much about your blood lineage, your genetic component, but it's about what happened during the critical period. Imprinting is basically a phenomenon where you all pernah dengar tak yang different animal raised by different animal? Pernah dengar tak?
Kena.
Yeah.
Kan? Contohnya very rare lah, tapi banyak ada contohnya anak kucing yang dibesarkan oleh anjing. Okay, so that's what imprinting, which basically means kan kalau kita tengok cerita kartun, kalau dinosaur telur dia pecah, siapa-siapa yang ada depan dia akan panggil mama, kan? Mama. Padahal orang tu bukan mama dia. Kalau you tengok cerita apa yang recently ada that kind, Ice Age yang ada at one point yang that apa nama binatang tu dia bela dinosaur ni. So dinosaur tu pun ingat that's dia punya mama. Ice Age 2 or 3 saya pun tak ingat lah. Tapi that is basically imprinting. So maksudnya what they're saying is attachment ni can occur to any two individuals as long as emotional connection to is there. Okay, so the theory comes from a psychoanalyst by the name of Bowlby. Okay, so Bowlby yang developed this attachment theory. Okay, now one of the things yang help us to understand about attachment is something that we call a circle of security. Now you all ni semua tak ada anak lagi, tapi maybe if you have seen your younger brother ke, younger child ke, niece or nephew, and if you can imagine, for example myself lah, so saya bawa, I bring my child, my 3-year-old child to my friend's house. So initially my child will attach to me, so dia akan rasa takut untuk go anywhere, akan duduk dengan saya. But over time, once they feel comfortable, dia dah duduk lama sikit dekat rumah kawan tu, dia start explore, dia pergi dekat tangga, dia pergi dekat ni, dia nampak toys room, dia masuk dalam toys room. And then suddenly there's a stranger, there's a anak tuan rumah tu comes, dia takut, kat mana dia akan pergi?
Dekat parents.
Dia akan come back to me. Why kenapa dia balik to me? Why does he come back to me? Because the theory is parents yang attached to the child become secure base. And dia macam kalau askar kan kita panggil base kan. Any problem, balik semula ke pangkalan, come back to base. So basically the properly attached child will have a secure base. The secure base provide protection, comfort, happiness, and help the person to organize dia punya feeling. Alright, so at the same time, dia akan grow, dia akan explore. But whenever dia feel insecure, dia akan come back to secure base. Alright, now the proper attachment ada this component. Dia ada secure base, dia ada exploration, and dia akan ada tendency untuk come back to secure base once they feel uncomfortable. So this is what we meant by circle of security. Now, problematic attachment will result in either poor development secure base or poor ability untuk living the secure base. Okay, now even though it looks like this is something commonly happen in younger children, tapi sebenarnya the circle of security also occur in a in older person. Okay, I'll give you an example. Budak-budak masuk UIA lah. Okay, so dia orang Kedah. So mak ayah dia dekat Kedah. Secure base dia dekat Kedah. Okay, so bila dah besar sikit masuk UIA, to enroll to UIA, to go to Kuantan, to come to Kuantan, stay in Kuantan. So whenever they feel uncomfortable, whenever they have problem in Kuantan, dia punya emotional akan urge dia to come back to the secure base. So if physically allow them to go back, so dia akan come back balik nak peluk mak dia. But if they cannot, they may use other methods to to call ke, contact ke. So that is an example where circle of security tu has expanded to the point where you can go, you can be further apart from your secure base, but nevertheless, whatever happened, you know that you have this secure base that you can come back. So this is basically an example of normal attachment, normal circle of security development, normal interpersonal relationship development. Okay. An example of abnormal circle of security can be, for example, a child who is yang parenting style, for example, authoritarian parenting style. Okay, authoritarian parenting style, in which they feel insecure dengan parents. Dia rasa macam kalau duduk rumah tu rasa macam duduk dalam neraka. So therefore, uh, parents has no longer become secure base of the child. So when the child explore the world, whenever problem happen, they will not have tendency to come back to the secure base, because secure base does not provide protection, comfort, delight, and organization of emotion to them. So this is when in real life a problem happen. So attachment problem can happen, for example, problem in patients yang ada problematic secure base, they have problem, so they go somewhere else to find security. So, for example, they have sexual promiscuity, or they use substance in order to find comfort. So this is an example where children have attachment problem in earlier life, and later life they develop psychological problem. Boleh faham tak?
Yes, Doctor.
Okay.
Yes, Doctor.
Okay. So attachment ni occur through stages. So the phase one is when phase one is what we call a pre-attachment stage. The first 3-4 months of life, where they start to know that, oh, mother ni is somebody yang I can rely on because she provide milks for me, she provide comfort for me. Okay. Now phase two is attachment in the making. They start to have preference to have one or two person. Third stage is where they already attached to that person, which basically means if that person that they attached to is no longer there, they become distressed. So this is when basically they start to develop separation anxiety. Okay, so contohnya kalau you take away a 2-year-old boy or girl from the mother, dekat school ke, dekat sekolah ke, they're not comfortable with, they akan develop emotional problem. They become distressed, temper tantrum. So that is what we call a clear-cut attachment. It's already developed. And later on in life, once the attachment to develop, they akan expand. So they akan start jadi attachment to 2, 3, 4 people, more people, and then there's a complex relationship. Maksudnya ada masa dia boleh percaya, ada masa tak boleh percaya. This is basically a normal relationship process. Okay. Mary Ainsworth ni tak payah risau lah, tapi basically Mary Ainsworth ni bagi tahu yang the quality of attachment tu akan affect. Contohnya kalau mak tu anxious, anak akan jadi poorly attached. Contohnya macam mak jenis anxious, the mother refuse for the child to explore the world. Cannot go there, you cannot climb, you cannot do that, you cannot do that. So that will result in poor in emotional ability to cope with normal life. So that can contribute to having psychological problem in later life. Pattern of attachment. Even though attachment to occur in every child, as long as mother or father provide necessary requirement for the child to develop. However, there are also abnormal pattern of attachment. So 65, this is based on this study by Mary Ainsworth. Dia kata 65 of child will eventually develop secure attachment. So dia ada parents yang dia rasa as a secure base. Dia akan ada element of anxiety whenever they are not around with their secure base, but they will feel comfortable once their parents are around or once their attached figure are around. But there are also other kinds of attachment. For example, avoidant attachment, in which they they disregard their parents. They don't regard their parents as their secure base. Resistant or ambivalent attachment, in which they have uh, an abnormal way whenever their parents are around. So that means even the parents have come back, parents get to them, they're still angry, they're still resistant to their parents, and difficult to comfort them. So this is kita panggil resistant attachment, difficult to attach to, or disorganized or disoriented attachment. So this is normally happen in children yang ada poor attachment development. So apa example of children yang ada poor attachment development? In which situation? Can we give example children yang something happen in life menyebabkan dia ada poor attachment? Hello, you still there?
Divorced parent.
Okay.
Trauma.
So for example, divorced
Abusive.
parent, abusive parents, good. Okay. So one classic example adalah children yang neglected, kena buang, lepas tu duduk dekat rumah pengasuh, lepas tu 2 bulan lepas tu pindah rumah parents angkat, and then parents angkat abuse, and then pindah rumah another parents, adopted parents, and then kena abuse again, and then move on to another place. So they never develop proper attachment. So we had one cases recently yang this child moved from one welfare house to another welfare house, sometimes eventually develop depression, personality disorder, self-harm, suicidal, psychosis, a lot of psychiatric problem as a result of poor attachment. Okay. So clinical implication of it, just a little bit of it, clinical implication of it, as I highlighted, it's important in your development of self-esteem, social relatedness, emotional stability. So it attachment influence this psychological development. Okay. So those who have attachment problem can have attachment disorders, can have problem with attachment disorder, attachment development. Contoh, those who have attachment problem can have a biological problem as well. For example, failure to thrive, psychosocial dwarfism, they can have separation anxiety, they can have personality disorder, they can have depression. So these are an example of complication later on in life where the problem started with attachment development. Children with abuse, for example, as you mentioned earlier on, tend to have attachment problem. Application in therapy. So basically, one of the things that we want to do in psychotherapy is to re-establish the attachment in order for them to feel secure, comfortable, and be able to process their own emotions whenever they have problems. So this is contohnya patient yang saya cerita tadi tu. And so what we do is we get one of the workers and to develop a secure attachment with the child so that the child will feel comfortable. Whenever you have problem, you have this person that you can refer to, that you can go back to in order to share your problem with. So this is these are the examples of application of attachment in clinical in clinical. All right. So those are the things that you have to know in attachment. Any questions with regard to attachment? Any questions?
Doctor, I want to ask, you said that attachment is not only focused to mother and child relationship. So what is the difference between attachment and transference?
Okay. Transference ni is transference ni attachment ni is relationship with regards to relationship. Okay, so mother child, mother father. Okay, transference ni is basically emotional connectivity. Maksudnya what you show, what you display in your connection. So it is short-lived. Contoh transparent is bila jumpa orang tu you rasa geram saja. You rasa dia ni macam mengingatkan siapa dia, you don't like. So that is transparent. So that is short-lived. Masa tu je lah. You don't carry that throughout your life. So attachment ni is something yang more long-lasting. So contohnya once you attach with your mother, So you attach every day, every month sampai you besar. So that's attachment. But transference ni dia dynamic, they change over time, they change over days, they change over periods, they change over interactions. So it's not the same. So attachment, transfer ni selalu kita sebut dalam psychotherapy. We don't talk about transferring in relationship as much. Okay, alright. So we are running out of time. So maybe the last few minutes ni I just show you some questions for you to practice and try to answer to see whether you can relate with the example that I have given to you earlier on. Okay. Boleh ya? Boleh tak?
Sure, Doktor.
Boleh.
Alright, now yang ni saya nak semua orang jawab dekat chat Semua orang jawab dekat chat. Kita nak tengok. You all kena type lah maksudnya. You all type jawapan you all . Okay, which of the following is not an indicator of cognitive development? So A, attention, B, imagination, C, language, D, interpersonal, E, creativity. So which of the following is not an indicator of cognitive development? Attention, imagination, language, interpersonal, creativity. Okay, jawab. Tengok sikit jawapan. Chat. Kena tengok chat. Okay, alright. Cuma tiru je ni. Tak ada yang nak jawab lain sikit. Alright, so your answer is sorry. Your answer is creativity. Semua orang jawab E ya. Jawapannya salah.
Saya jawab D.
Jawapan dia sebenarnya adalah D. Okay, interpersonal. So interpersonal is actually apa? Domain apa interpersonal?
Social.
Psychosocial and psychological and social. Social. So interpersonal is social. Attention, imagination, language, creativity ni semua is part of cognitive development. So creativity should occur at some point in life. So kalau tak ada creativity, maknanya your cognitive development affected. Macam mana ni salah tadi? Itulah lain kali jangan ikut orang semua E, awak ikut E. Okay, second one Which of the following is related to Piaget's theory of child development? So kita cakap tentang tiga kan. Piaget, Freud dengan Erik Erikson. So which one of the following is related to Piaget? You all nampak slide saya kan? So A, sexual drive, B, moral development, C, identity crisis, D, separation anxiety, E, abstract thinking. Okay, apa jawapan dia? Right, jawab. Okay, ada jawab B, Mosi jawab E. Tadi E salah dah. Awak sure this time pun E juga? Okay, so jawapan dia ialah Jawapan dia ialah E. Okay. You all nampak slide saya ke nampak saya?
Nampak dua-dua.
Okay, alright. So, jawapannya adalah E. Okay. Sexual drive apa? Teori siapa? Sexual drive teori siapa?
Sigmund Freud.
Freud. Moral development, Kohlberg yang kita tak discuss tadi. Identity crisis, teori siapa? Siapa yang cakap tentang identity crisis? Siapa? Freud ke, Erik Erikson ke, Piaget?
Erik
Erikson kan dia cakap tentang every stages tu ada dia punya virtues dia. So identity crisis ni masa adolescent. Separation anxiety, siapa cakap asal separation anxiety? Baru belajar tadi. Under attachment, siapa yang create teori, siapa yang propose teori pasal attachment? Bowlby. Okay, Bowlby. Alright. So jawapan dia E, abstract thinking. Okay. Low responsiveness, high control. Which of the which parenting style relates to this statement? Low responsiveness, high control. Okay, cepat. Low responsiveness, high control. Tengok sikit depan. Authoritarian ke, authoritative, permissive, neglectful, avoidant. B. Orang B. Okay, alright. So jawapan dia adalah B, authoritarian. Okay, so sangat controlling tapi tak responsive. Authoritarian. Okay, 4. Which of the following is true regarding attachment? Okay, ni kena baca sikit Which of the following is true regarding attachment? It is based on psychosocial theory of development. A. B. Defines as affection of mother towards the child. C. Secure based development is part of the process. D. Only develops within the same family. E. Poor attachment causes schizophrenia. Yang mana yang betul? A, B, C, D, E. Ada satu je yang betul. Yang mana yang betul? Okay, tengok sikit jawapan. C. Semua D2. C. Okay. C. Tak ada yang lain daripada C. Confidence C. Okay, alright. So jawapan dia adalah C. Okay, now A, it is based on psychosocial theory. Salah sebab apa? Apa yang based on psychosocial theory? Siapa punya teori psychosocial?
Erikson.
Erikson. Okay, defines as affection of mother towards the child. Apa yang salah?
Emotional.
Not necessarily mother.
Jawapan dia salah sebab it's not mother towards the child. It's the child towards the mother. So attachment is child towards everybody else. Kalau mother towards the child, itu nama dia apa? Nama dia bonding. Okay, so caregiver towards the child kita panggil bonding. Child towards caregiver kita panggil attachment. Okay, so D and E itu salah lah. Okay, yang kelima, last. Delay in maturity of prefrontal cortex in adolescence results in A. Delayed menses, B. Emotional stability, C. Poor judgment, D. Dwarfism, E. Short stature. So delay in maturity of prefrontal cortex results in A, B, C, D, E. Senang je kan soalan saya buat untuk year 1. So tak payah risaulah. Senang je. Psychiatry punya part ni senang. Yang lain-lain tu susah. Alright, so jawapan dia ialah C, poor judgment. Okay, alright. So because prefrontal cortex, dia punya function dia adalah executive function. Kalau dia kata emotional instability, B pun betul. Tapi sebab dia kata emotional stability, therefore B tu salah. Alright, okay, last. Any question? If there's any question, last before kita tutup. Okay, tak ada ya? Tak ada? Ni je saya punya kelas dengan you all. Kita jumpa year 4. Kita jumpa 3 tahun lagi. Okay, alright. Kalau tak ada soalan, dah 12:45 dah. Nak ready to mayang. Siapa yang mayang? Thank you so much. If there is any problem with regards to the topic, just email me and I will respond it. Bukan personal yang related to apa kita panggil, yang related to topics that I presented lah. Alright, thank you so much. I will share with Zarif the recording nanti, and then you can all view back lah if you have any problem. Alright, Assalamualaikum warahmatullahi wabarakatuh. All the best for your end of block exam later on lah. Saya bagi banyak tadi tu soalan. Saya bagi banyak tadi tu, just go through, should be able to answer that one. Okay, Assalamualaikum warahmatullahi
Thank you, doctor.
Thank you, doctor.
Thank you, doktor.
Thank you, doctor.